Chronic stress does more than affect your mood, it can physically reshape your brain. In this lesson, family nurse practitioner Hollie Hristov explains how stress impacts memory, decision making, and long term brain health.
So, chronic stress, anxiety, depression, so if not effectively managed over time, can cause changes in brain size, so structural changes. Chronic stress could actually decrease the size of the hippocampus, which is the memory center of the brain. And it can also affect the prefrontal cortex, which can impact things like executive function, decision making abilities, emotional regulation. It can also impact the stress hormone. So, cortisol. So over time, those levels can actually raise and stay consistently high. And this actually can reduce the body's ability to handle stressful situations over time and also decrease hippocampal size as well. There's also the risk that poorly managed stress can impact neurochemicals in the brain. So dopamine, serotonin, all those things that really impact mood. So you're more likely to be anxious and depressed if you have chronic stress. It can really impact sleep pretty greatly, which is one of those really important modifiable risk factors that we work on with our patients. It can also increase the risk for cardiovascular disease, metabolic disease, which can impact the risk for dementia. It also affects neuroplasticity, so the brain's ability to form new neural connections, which over time can impact the brain's ability to adapt. So, some things to watch out for can be feeling foggy or the inability to really focus on an activity or a task, or having really poor concentration, slower processing, or a major shift in the ability to process new information, the inability to remember appointments or recent conversations that you just had, a lack of motivation, or fatigue, feeling overwhelmed about like just everyday simple tasks, like, doing the dishes or doing the laundry, or can really be some early signs that stress is negatively impacting the brain. And then in turn, when you're feeling those things, like you just really want to be mindful. And then that's when you really want to try to, you know, grab the wheel and divert, because that's when you can make big changes. So cortisol can be beneficial to track over time. However, a fasting cortisol level on the labs isn't always the best way to do that. There's other ways that are more in depth that you can do. But if you're going to a general practitioner and maybe they don't do the functional medicine test like a functional doctor would, asking to track your cortisol over time would be helpful. Um, and I think that it's a good gauge. It's not perfect, but it's a good gauge to see if that stress is really impacting your body function. I feel like every stage of life comes with its own challenges and stressors. Um, you know, Mid 30s is stressful because you're, usually starting your career, kicking off life, trying to earn money. Your 40s, you're probably raising kids, which can be stressful. You're planning for retirement. You're probably growing in your career. 50s, you go through also hormonal changes, menopause, andropause, all those things. So every life stage has different stressors, but learning what ways to manage that stress for you specifically is really, really key.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.